Across the United States, more and more people are experiencing a sudden and unpleasant illness. This wave of sickness is catching many off guard, disrupting daily routines and causing widespread concern. They're grappling with nausea, vomiting, and diarrhea. These symptoms can strike suddenly and with great intensity, making it difficult for individuals to go about their normal activities. This isn't just a passing bug, it's a surge in norovirus cases, and it's something we need to pay attention to. Norovirus is highly contagious and can spread like wildfire through communities. Health officials are particularly concerned because this highly contagious virus spreads rapidly, especially in crowded settings like schools and care homes. These environments are perfect breeding grounds for the virus, making it hard to contain. The symptoms can be quite debilitating, leaving people feeling awful for a couple of days. The intense discomfort can lead to dehydration and other complications if not managed properly. While most healthy individuals recover quickly, norovirus can be more serious for young children, the elderly, and those with underlying health conditions. These vulnerable groups may require medical attention to ensure a full recovery. That's why it's crucial to understand what we're dealing with and how to protect ourselves and our loved ones. Simple measures like frequent hand washing and disinfecting surfaces can go a long way in preventing the spread of this virus. Norovirus is a highly contagious virus that causes inflammation of the stomach and intestines. This inflammation, known as acute gastroenteritis, leads to a range of unpleasant symptoms. The most common symptoms of norovirus are nausea, vomiting, and diarrhea. Some people also experience stomach cramps, fever, headache, and body aches. These symptoms typically appear within 12 to 48 hours after being infected with the virus, while most people recover within 1 to 3 days. It's important to remember that norovirus can be more serious for vulnerable populations. Norovirus is incredibly contagious and can spread rapidly in crowded places. It spreads easily from person to person through direct contact, such as shaking hands. You can get norovirus by coming into direct contact with an infected person, touching a contaminated surface, or even by touching objects that an infected person has touched. Consuming contaminated food or water is another common way the virus spreads. This often happens in places like restaurants or through improperly handled seafood. This virus is commonly spread through fecal matter, which can contaminate surfaces in food. Imagine someone doesn't wash their hands properly after using the toilet. They can easily transfer the virus to anything they touch. If they then touch a doorknob or prepare food, the virus can spread to others who come into contact with those surfaces or eat the food. The virus can linger on surfaces for days, making it easy for others to pick it up and become infected. It's important to be mindful of hygiene practices, such as washing hands thoroughly and regularly to prevent the spread of this virus. Always be cautious and maintain good hygiene to protect yourself and others. The good news is that there are simple yet effective steps we can take to protect ourselves and others from norovirus. By incorporating these practices into our daily routines, we can significantly reduce the risk of infection and maintain a healthier environment for everyone. Firstly, frequent and thorough hand washing is crucial. This simple act can remove germs and prevent the spread of the virus. Wash your hands carefully with soap and water, especially after using the toilet, changing diapers, and before eating or preparing food. Make sure to scrub all parts of your hands, including the backs, between your fingers, and under your nails. Hand sanitizer can be used as an additional measure, but it's not a substitute for proper hand washing. Always opt for soap and water when available. Secondly, be cautious about food preparation. Contaminated food is a common source of norovirus outbreaks. Wash fruits and vegetables thoroughly before eating them. This helps remove any potential contaminants that may be on the surface. Avoid preparing food for others if you are experiencing symptoms of norovirus. This includes nausea, vomiting, diarrhea, and stomach pain. If you're feeling unwell, it's best to stay home and avoid contact with others to prevent spreading the virus. Rest and hydration are key to recovery. Remember, preventing norovirus is everyone's responsibility. And by following these simple tips, we can help protect ourselves and our communities. Together, we can create a healthier and safer environment for all.